Hi guys, welcome to the Toothfairy channel. Thank you so much for tuning in. Today, we're going to talk about periodontitis. You see, periodontitis is very serious. It's actually a more severe form of periodontal disease. And unlike gingivitis, it is not reversible. Periodontitis can lead to tooth loss, pain, infection, headaches, bad breath, bleeding. It's bad. But it is manageable even though it's not reversible. And today, I'm going to teach you exactly how you can manage it. So, what is periodontitis? One word: destruction. Periodontitis destroys everything. Periodontitis is just a very severe case of periodontal disease. It destroys the fibers, the ligaments, it destroys the tissues around your tooth. It eats away your bone. And think about it, if you have all of these bacteria just eating away your bone that is holding your tooth in place, what's going to happen? Your tooth eventually is going to become mobile because it's not going to have any support. Without support, you're going to lose your teeth. And that's why managing periodontitis, it is essential. It is important to manage periodontitis before it gets to that point. Signs and symptoms varies. It depends on the person and depends on the host, because not everyone would be affected the same way with the bacteria or periodontitis. But the most common symptoms and signs are like increased pocket depth, which means that you have some bone loss. I will show you what that looks like. I'm gonna type it down here shortly. Pus, bad breath, bleeding on your gingival tissues, and you can also have a lot of redness and puffiness on your tissues. You can have some tenderness in your tissues, discomfort, pain while you're chewing. Even if you're not chewing, you might still have pain. The other thing that you can have is kind of like a little bit of separation from your gums to your tooth. You might see like a little bit of separation. You might notice a change in your bite, because like we talked about earlier, with periodontitis, you might have some loose teeth. If that happens, they're gonna move a little bit. So you might notice a little bit of a difference when you bite down, like the way your upper and your lower teeth come together, it might feel different. So those are the most common. Another thing is bad breath. Periodontitis definitely has a very particular smell to it. It's pretty much bad breath times 10. So it's very particular. So those are some signs and symptoms of periodontitis. There are different risk factors for periodontitis. I feel like the number one is to have poor oral hygiene. That means not brushing twice a day for 2 minutes, not flossing, not properly removing the biofilm, or what you would call plaque, from your tooth. So that definitely contributes to periodontitis. Smoking, definitely a factor. Diabetes, increasing age, genetics, poor nutrition. If you are lacking certain vitamins and you eat poorly, a lot of fast food and not a lot of vegetables or fruits, it can definitely contribute to periodontitis. Poor dental restorations. What this means is if you have a filling with an overhang, if you have a crown that is not completely flush with the tooth, it definitely contributes to periodontitis. The reason is because it's like a food trap. You know, it's hard to clean, and it's a trap for bacteria and food to get there. So that's why you usually will have a little bit of bone loss on those areas where you have bad margins or not fully flush crowns or restorations. Another contribution would be hormonal changes and immune disease or disorders. Immune disorders would be like if you have lupus, if you have cancer, if you have HIV. Conditions like that, unfortunately, they do contribute to periodontitis. Okay, so you go to a dental office. The first thing that they're gonna do is take some radiographs, x-rays. On the radiographs, if you have just a little bit of bone loss, it is difficult to see on a radiograph. You can detect it. However, when you have periodontitis and it's severe and you have a lot of bone loss, you can see that on the radiograph. You can actually see where the tooth is, and you can actually see the bone where it starts. So when there's a drop, we know that there's definitely something going on there. Whenever you go, they have radiographs, you have the doctor do a checkup, and then you have the hygienist. The hygienist will come and do some probing. It's some pocket measurements. So they take a probe and they actually do some measurements in each tooth, front and back, just to see where you have the bone or bone loss. So if you have 1 to 3 measurements, that's good. If you have a 4 measurement, that's inflammation. But if you have 5, 6, 7 like millimeter pockets, that means you have some serious bone loss there. So I'll show you what that looks like here in a minute. Okay, so you are at the dental hygienist chair, and this is pretty much what would happen. They're gonna do an exam, and they're gonna check your pockets or your teeth, front and back. They're gonna take their probe, this, and then they're going to do measurements like this, all around. And you can see here in the tissue how deep this is going because it's see-through. Obviously your tissues are not see-through, but this is just so you can see. So if you have 1, 2, 3s like this is good. But if you have this deep, you see how deep it goes? That's not good. That's a lot of bone loss. That's almost an 8 millimeter pocket. So that's definitely some bone loss there. It's a little bit uncomfortable. The reason why it is uncomfortable is because you have inflammation. It's a tight space. They're obviously poking, but unfortunately it is something that they have to do as part of the exam. This way they can better diagnose you if you have periodontitis, inflammation, gingivitis. It is very important for you to go to the dental office because the faster they diagnose it, the better. The faster they diagnose it, that means that they can prevent less damage and they can help you and give you better options on how to definitely lessen the effects. I do want to point something out right here actually. So you see here, a tooth is missing, right? But do you notice this tooth is lower, like coming out more than these? You see these teeth are here and this one is here, but this tooth has dropped. Well, when you have periodontitis, you have mobility because you're losing bone. So if, for example, this tooth had a lot of bone loss and they took this tooth out, now you have nothing. Well, this tooth right here, you see it dropping? Well, that happens because there's no tooth here. You see, teeth are very friendly. Teeth like to be next to each other. They like to touch. Well, because here there's a tooth missing, now this tooth has no contact and it doesn't like it. So it's going to drop because it's trying to find something to touch, to contact. So whenever you have a tooth extracted, that comes with a whole lot of set of problems because now you have this tooth shifting down, this tooth is going to shift sideways, this one sideways, because they're trying to fill the space. So I just wanted to point that out. Alright, so I talked about the measurements. Now, let's say that they diagnose you with periodontitis. They say, hey, you have a lot of bone loss, and this is what we're going to do to help you manage it. Well, you have different options. If they do the measurements and they find like you have a lot of pockets in certain areas, like if you have a 6, 7, 8 millimeter pocket, they can actually put antibiotics on it. They can put something called Arestin or a Pure chip, which looks like a little popcorn kernel. I'll put a picture here above somewhere so you can see what that looks like. But they could put a medication. The medication is pretty much like an antibiotic, but like a localized antibiotic, because they actually put it inside the pocket to help it heal. So if they suggest that, they're not trying to take your money. They're just trying to help you. They're trying to close that space and close the pocket and help you heal. So if they suggested, it is expensive. I get it. Dental stuff is expensive. I understand. But it's your tooth. You only get one set. You're not an alligator. You don't regrow them. So if they suggest it, please consider it. I would like you to keep your teeth. And if you don't, I already told you, other stuff happens with dropping and moving teeth and shifting. So if they suggest it, it's a good option. But again, it's called Arestin or a Pure chip. And I'll put both pictures of what that looks like somewhere floating around me. So you can see that, but that's something that they will do. The other thing is you go to the dental office and you just want your free cleaning. You just want whatever your insurance pays for. Unfortunately, that's called a prophylaxis, a regular cleaning for healthy people. If you have a periodontitis, they cannot just do a simple regular cleaning on you. They legally cannot do that. So it's not that they're trying to take your money, it's that it's unethical because they're not providing you the treatment that you need. So if they tell you, hey, you need a deep cleaning, and you said, no, I just want whatever my insurance covers, I just want my free cleaning. I'm sorry, it doesn't work like that. And that's just the way it is. You see, if they do a regular cleaning on you and you have periodontitis, you're not getting the help that you need. And eventually, your case is only gonna get worse. So as time goes by, you just get your free cleanings, and then your pockets are getting bigger and you keep getting more bone, like bone loss. Next thing you know, your tooth is moving and you don't understand why. Well, it's because you didn't get the treatment that you needed. So it is expensive, I totally understand, but it is what you need. So those are your options. They will tell you if you need a deep cleaning or what kind of cleaning they're gonna do. Trust them, they are your provider. So just trust them, because trust me, they want the best for you. That's why we do this. If they suggest the antibiotics, it's wonderful. I can't really tell you a price on that. Every office is different, but if you're able to, I would definitely suggest to take them up on that, because it can definitely help you heal the pocket. It's a little antibiotic that they put to help seal in the pocket. Oh, it's painless, by the way. It doesn't hurt at all. It's like a little, if they use the period chip, which is like a little popcorn kernel, they put it inside with pliers. If it's the Arrestin, it's like a little medicine that they shoot it up, but it's completely painless. And it only takes a few seconds to put the antibiotics on the pocket. So it's definitely doable. But that's why if you have periodontitis, there's definitely options. It does cost money. I mean, that's just the world we live in. But that's another reason why they cannot do a regular cleaning. I see it all the time where patients come in, I just want whatever my insurance pays for. So do we, but that's just not the way it works. So if they tell you, I'm sorry, you have periodontitis, you need a deep cleaning, please trust them. They just want that. They just want the best for you. And if you have the pockets and the bone loss, you want to manage it soon before you start losing teeth and start getting mobility and things like that. Unfortunately, as we talked about before, it's not reversible. However, you can manage it. And if they catch it early, then better yet. A dental hygienist can only do so much. So if your periodontitis is to a certain degree where, every time that you come, your pockets are bigger, you're not getting healthier, and you're not staying stable, it just keeps getting worse and worse. Well, at that point, you will have to see a specialist, a periodontist. The periodontist is a specialty dentist. What he does is he takes care of people that have a lot of bone loss and resection. He's able to do surgery, where a dental hygienist cannot do surgery. The periodontist can actually do a flap and add bone on the teeth where they're loose, because you have a lot of bone loss. He can actually add bone. If you have gum recession, he can also fix that, but it's always surgery. So if the degree of periodontitis is very severe to the point where a dental hygienist cannot manage it, well, at that point you will have to see a periodontist, and he's a specialized dentist that specializes on periodontal disease. If you are diagnosed with periodontitis and you get your deep cleaning, they do your deep cleaning, they do your medication. Well, afterwards, you're not done. So once you do your deep cleaning, that's your first step, you have to do something called a periodontal maintenance. That means that you will have to come to the office either every 3 months or every 4 months to do your periodontal maintenance. Because after they complete your deep cleaning, well, you're not healthy. Because remember, it's not reversible, it's only manageable. So you have to keep coming back in order to make sure that your pockets stay healthy, nice and clean. You need to make sure you do your part at home. You need to be able to clean your teeth, do it twice a day for 2 minutes faithfully every day. Make sure you floss. We talked about it in my previous videos. Brushing alone, it's not enough. You must floss. I actually have this toothpaste is great too. The Crest Gum Detoxify. It's a wonderful toothpaste. The other thing is, if you use a manual toothbrush, switch to an electric. It's actually more effective. The Oral-B is a great brand. the electric toothbrush is actually more effective in removing the biofilm. So I'm actually gonna add the links below, check them out. It can take you straight to Amazon, straight to the products that I'm recommending for the toothpaste, the toothbrush, and even a tooth floss. I have my favorite, it's called Glide. It actually tastes pretty good, very minty, and it doesn't tear. Like, I hate when you have a floss and it tears. I'm sure that you guys have experienced it, but I've been using this floss for years, the Glide, the floss Glide. They have different colors. I use the gray one, and it does not tear at all. I love it. So I'll definitely add a link below so you can check out those products. It can definitely take you straight to the link if you're interested. But definitely do your part at home. Make sure that you are keeping up with your period maintenance. If they tell you come back every 3 months or every 4 months, come back every 3 or 4 months, whatever they tell you. If use the electric toothbrush, brush twice a day, have good nutrition, stop smoking, control your diabetes, make sure you see your regular doctor to make sure that everything else in your body is normal and healthy. But if you have periodontitis, we can manage it. Just, you have to work together with your provider. You have to do your part, they will do their part, and work together as a team. It's manageable, but you must do your part. Alright guys, thank you so much for watching. Thank you for your time. I just want to say that I am not sponsored by any of these companies. This is just products that I love and I enjoy using, and I like to recommend them. But I appreciate you watching. Hit the button. You can hit the Toothfairy and subscribe so you can be updated every time that I upload a video. If you find that this video was useful, I encourage you to like it, comment on it, share it. I really appreciate the support, and I look forward to seeing you on my next video. Thank you so much for your time, for your support, and until next time. Thanks for watching the Tooth Fairy.